Hello dear students, welcome back to my YouTube channel Physiology Learning. In this video we are going to see what are the waveforms in the various different leads of the ECG. So how will the waves appear in various different leads of the ECG? In the previous ECG wave generation, we studied that the PQRST wave generation and we studied specifically in lead 2. So their appearance in lead 2 we have studied, but some of the leads are placed in a position which is different from lead 2. So the normal waves itself will appear different in them. So we have to have an idea whenever we are analyzing the entire ECG, that is a 12 lead ECG, how the other waves will look normally in the other leads. So let's get into the topic, the waveforms in various leads of the ECG. So coming to the limb leads first. All of us know we have three limb leads, that is the lead 1, lead 2 and lead 3. If you concentrate and look at the lead 2, which we discussed already, the right arm was negative and the left leg was positive. And the heart is in this position and most of its depolarizing waves are coming like this. So that is why the QRS complex, especially the R wave, came out to be positive. As you can see the tallness of this R wave in the lead 2. That is because the R wave, which is the major ventricular depolarization, happens in the direction or the positive direction of the lead 2. The positive side is here, so it happens like that. So with this understanding, if some lead is placed, some of the leads positive direction, the waves are going, so the QRS complex will be positive. So we will try to concentrate on the, especially the R wave pattern. How the R wave is going to look, because that is the major wave which looks in which is taller in the ECG, and with the help of that we can understand how is the direction of the particular lead. And coming to the other leads, this is the lead 2 which we have already done it. Now let's see the other limb leads, that is the lead 1 and lead 3. In lead 1, the right arm is negative whereas the left arm is positive. And majority of the major ventricular depolarization wave, it is going like this. It is going in this direction. So as you can see here, it is not going exactly in the direction of the lead because the left arm's lead is positive here, and it is not going away from it also. The positive waves are going towards the direction of the positive only, but still it is not in the exact direction. So what happens to the R wave? The R wave will be still positive. The R wave will be still positive, but as you can see here, it is not in the exact direction. So the lead is here, but my waves are going like this. So the lead is placed on this right arm and the waves are going like this. So what happens here is the waves will be positive, but they will be smaller in amplitude. As you can see here, they are smaller in amplitude. Now coming to the last limb lead, that is the lead 3. Here the positive wave is in the left leg again, and the left arm is negative here. The left arm is negative and the left leg is positive. As you can see here, the major R wave is going towards the direction of positive again because it is the left leg. So that is why in lead 3 also we get a positive R wave, and it is slightly little less taller than the lead 2 because it is not exact direction of the major ventricular depolarization but almost similar to that. That's why lead 2 will have the major R wave followed by lead 3 and then the lead 1. So as you can see here, that is why Einthoven constructed leads in such a way that majority of the R wave recording comes out to be positive. That's why he kept this left leg as positive in both lead 2 and lead 3, and the right arm, which is facing away from the heart, as negative always in both the conditions. So that is the logic behind it. So this is all about the limb leads. Now let's try to understand how they appear in the augmented leads. So augmented leads, we have three leads. One is the AVR, which is in the right arm, and the AVL, which is in the left arm, and the AVF, which is in the foot. I already told you these are unipolar leads. These are unipolar leads. Unipolar leads means this is going to have one exploring electrode and the other is going to be a zero amplitude, that is the neutral electrode which is connected to the high resistance. So the AVR, if its recording is there, so AVR is here and it will take the potential only from here. And all of us know that the AVR, if it is positive and the waves are going like this, the AVR is positive here, the waves are going away from the AVR, especially the R wave. So how will be the deflection of R wave in the AVR? The deflection will be negative. This is a normal finding. Many people think that once they look at the AVR, they think that the QRSS complex is inverted. There is some abnormality. It is not like that. The AVR is taking the picture completely away from the deflection. The positive side of AVR is here and it is looking at the heart away from it. So that is why the R wave is negative in case of an AVR in a normal condition itself. Now coming to the other lead, the AVL. The AVL is looking the heart, the positivity is here and the depolarization positive is also going in that direction only, a little away from it, but still it is in the positive direction. So that is why AVL is again positive, whereas AVF is like it is in the foot and it is the positive wave and exactly it is going in the direction of the positive wave. So AVF is looking the heart from below. So this AVF is again positive and this AVR should be negative in a normal person. The AVR is looking at the heart away from the heart. So this should be negative in a normal individual. So this is one important point. Many of people tend to find AVR negative and they get panicked why it is the inverted wave. But the logic behind that is it is looking away from the heart. Next, coming to the chest leads. And all of us know chest leads we have V1 to V6. And V1 is placed in the fourth intercostal space on the right side, then V2 is on the left side, then V5, V6 and V4 are in the fifth intercostal space on the right side. So this is the arrangement. We have already seen the arrangement and these are also unipolar leads and they are going to explore it. Now a simple question I will ask you, the lead which is looking away from the heart. For example, as you can see here, the V1 is on the right side, but the waves are going away from it. So the V1 recording, how will be the R wave? The logic is very, very simple. The R wave will be inverted, just like AVR, because these leads are looking away from the heart. And as we progress from V1 to V6, what is happening? The heart's direction is being aligned. So the the R wave will become positive as we move from V1 to V6. So initially it will start with negative because it's the V1 is looking at, and maybe in between in the fourth one it will be completely taller. Why? Because it is just aligned in the direction of the heart. So this progression of R wave should be looked at whenever we are reading the chest leads. So let's try to understand how they look. So from V1 to V6, as you can see here, from V1 to V6, the V1 initially the wave is negative, then after that slight positive increase, then it becomes in V3 it is bipolar. Now it is bipotential, like positive is also there, negative is also there. Then in V4 it becomes positive and V5, V6 also again it becomes positive. So this process is called as R wave progression. R wave progression. Again, do not get panicked once you see an inverted R wave in case of the V1. That is completely normal because V1 is looking the heart away from it. So this is how the lead in the chest leads, the waves are looking. Now let's get an overview. The standard 12 lead ECG, whenever you take the printout, it's going to give the waves something like this. As you can see here, first the limb leads, lead 1, 2 and 3. As you can see here, all of it, the R wave is positive. Why I am stressing on the R wave is, other waves you can imagine and understand, but the R wave looks very prominent. So if you understand it, the simultaneous waves, it's easier to predict. Then AVR is negative, whereas AVL and AVF are towards the positive. Here a little bipotential they have shown it, but still AVL can be positive also. Then V1, the R wave is inverted, as you can see from here. And as we progress from V1 to V2, then V3, then V4, then V5, V6, the wave becomes upwards. This R wave progression should be noted whenever we are looking at the precordial leads. In V1, it will be in the inverted wave. In V6, it will be a straight wave. So this is how the various leads of the ECG look at the heart, and that's why we are taking multiple pictures. So everybody is looking at the heart from different directions. So that will give us an overall perspective. So once we study about a myocardial infarction, we will try to understand like why we are taking this many leads, and can we find out which particular wall, that is whether the inferior wall is affected or the lateral wall is affected or the anterior wall is affected. of the ventricle is affected. That can be easily identified by just looking at the standard 12-lead ECG. I hope it's clear. Thank you for watching the video. If you have any doubts, please do drop it in the comment section. Thank you again.